নমস্কার, আপনারা দেখছেন অ্যাপোলো হসপিটাল চেন্নাই প্রেজেন্টস হ্যালো ডক্টর। আপনাদের সঙ্গে রয়েছি আমি স্মৃতি। কোলোরেক্টাল এই সমস্যাটা ঠিক কি, শরীরে এর কাজ কি, কখন এটা চিকিৎসা প্রয়োজন হয়, কখন এটা ক্যান্সারে পরিণত হয়, এই সমস্ত বিষয়গুলি যদি অনেক আগে থেকেই আমরা সচেতন হয়ে যাই তাহলে আর সমস্যা খুব বেড়ে যায় না। কিন্তু না, আমরা অবহেলা করি, নেগলেক্ট করি এবং সেটা তারপর গিয়ে পৌঁছয় একটা মারাত্মক আকারে। সেটা যাতে না হয়, আর সেটা হলেও আমাদের বাঁচার উপায় আছে। অ্যাপোলো হসপিটাল চেন্নাই সেই সমস্ত ভয় আপনাদের দূর করে দেবে। কোলোরেক্টাল সম্পর্কে যাবতীয় বিষয় আজকে আমরা আলোচনা করব হ্যালো ডক্টরে। এবং কোলোরেক্টালে কি কি অ্যাডভান্সমেন্ট হয়েছে অ্যাপোলো হসপিটাল চেন্নাইয়ে এবং তার এক্সপার্টসরা কিভাবে তারা ইতিমধ্যেই বেশ কিছু অ্যাচিভমেন্ট তারা পেয়েছেন, এই সমস্ত কিছু তুলে ধরা হবে আপনাদের সামনে। আর আমাদের সঙ্গে রয়েছে অ্যাপোলো হসপিটাল চেন্নাইয়ের তরফ থেকে ডক্টর ভেঙ্কটেশ মুনিকৃষ্ণন রয়েছেন আমাদের সঙ্গে। হি ইজ অ্যান সিনিয়র কনসালটেন্ট কোলোরেক্টাল অ্যান্ড রোবোটিক সার্জন, অ্যাপোলো হসপিটাল চেন্নাই। Sir, firstly, thank you for coming from Chennai and welcome.
Thanks for having me on the show.
Sir, firstly we discuss, can you explain what is colorectal?
So, colorectal is a subspecialty in gastrointestinal surgery. Now, we know when we eat food, the food goes through the mouth, goes through the food pipe, goes into the stomach, gets digested, the food comes down into the small intestine, all the necessary nutrients are absorbed and the waste material goes into the colon, where the water content in the food is absorbed or the waste material is absorbed and motions are formed and they move along the colon and come and get stored in the rectum, and when you go to the toilet you evacuate it. So any conditions or problems arising from the colon, rectum and anus is called colorectal diseases.
Sir, can you explain what is colorectal? Okay, I get it, some ideas. But sir, what is the common problem? What is the common symptoms of colorectal problem?
So the symptoms of colorectal disease typically are rectal bleeding, seeing blood in the motion, change in bowel habit where motions become very hard, constipation or loose, which we call diarrhea, passing mucus, weight loss, anemia. These are all other symptoms, but the main symptoms for colorectal problems are rectal bleeding and abnormal motions, which could be constipation or loose stools.
Sir, why recently most of the people suffering from this problem, fissure, fistula, piles, etc., this type of problem, why recently is increased?
So more recently there's more awareness about this. Two, also the lifestyles have changed. People eat out a lot, they eat more meat, they don't drink enough water, they eat less vegetables, more processed food, eating out in hotels, meal order services like Swiggy and
street food,
junk food. So when you don't have a regular diet, your digestion is affected and also what comes out is also affected. Because of that, a lot of constipation issues are there, inflammation of the gut can happen, so you get symptoms. So that's what the main cause for these problems are.
Sir, now we want to know what is colorectal cancer and what are the symptoms?
So as far as the symptoms of colorectal disease are concerned, I said there are two components. One, there is simple conditions such as piles, fistula, fissures, and also then the other end, which is colorectal cancer. Now the problem we face is that the symptoms for both these conditions are very similar. As we discussed, it could still be rectal bleeding, blood mixed in motion, change in bowel habit, which again is constipation or diarrhea, weight loss, anemia, some abdominal pain. So the confusion comes when we don't know what the underlying causes, but the symptoms are similar. So what happens, patients ignore these symptoms thinking that something very similar, maybe piles, some constipation, ignore it or feel embarrassed to go and see a specialist, and they end up with some complication. So the symptoms is, if you have symptoms of the change in bowel habit or rectal bleeding, any of these symptoms for more than 6 weeks, you should go see a doctor. Now when the doctor will examine you and identify if there's a simple problem like piles or a fissure or something more complicated which needs investigation further with something like colonoscopy, and to diagnose or exclude conditions such as colorectal cancer.
Sir, how is the or what is the recent advancement colorectal cancer treatment in your hospital? I want to say Apollo hospitals in Chennai.
Sure. So as far as the simple conditions are concerned, now they are very straightforward. If you have piles or a fissure, normally lifestyle changes will change. You drinking more water, having a healthy lifestyle, avoiding red meat, stopping smoking, reducing or stopping drinking alcohol, and eat home cooked food mostly. Yeah, you can go and enjoy a meal outside in a restaurant once in a while, but mostly well cooked healthy food is good for you. Now once you drink lots of water and you change your lifestyle, these symptoms will settle, constipation will improve, and all your fissure and your pile symptoms will get better. Now again, in spite of this, if there are still symptoms, then you go see a doctor. They'll give you some ointments and syrups, and which will improve your motions, and again the symptoms can improve and the condition will get better. If all this fails, then you may need some surgery, and your doctor will advise you accordingly. Now as far as fissure and piles are concerned, you try medical treatment, it fails, then surgery. If you have a perianal abscess or a lump which is infected around the anus or a fistula, the treatment is always surgery. So these are the common conditions around come around the anal area. Now as far as colorectal cancer is concerned, now what we are seeing is worryingly that colorectal cancer affects all age groups. We are seeing younger and younger people get colorectal cancer, so we can't really ignore these symptoms. Hey, you know what, I got these symptoms, it's something piles, or I will ignore it for now, because we are seeing young people in India getting a lot of these cancers. So if you have any of these symptoms of rectal bleeding or change in bowel habit, constipation, diarrhea, weight loss, anemia, you should, more than 6 weeks, you should go see a doctor. Now once you see a doctor, and they will do a clinical rectal examination, find out if it's a simple anal condition. If not, then they will ask you to go have some tests like colonoscopy, which is a gold standard. A colonoscopy is where you put a camera into the anus and check the whole colon, and if there's anything abnormal, we'll take a biopsy and send it to the lab. Now if there is a diagnosis of a colon tumor or rectal tumor, then a biopsy will confirm what type of tumor it is, and then the doctor will organize some scans like CT scan and MRI and see what stage it is. Now treatment for colon cancer is very straightforward. If you have colon cancer, you remove that part of the colon and join two healthy ends together, and based on stage you may need some chemotherapy to control the disease. Now if it's rectal cancer, which is close to the anus, it becomes more complex, because rectal cancer affects the way we defecate. So the standard of treatment for rectal cancer is based on stage is, first you will get chemo and radiotherapy to reduce the size of the tumor and to reduce the risk of recurrence. And once that chemotherapy and radiotherapy is completed, then you do surgery to remove the tumor and join it back. Now if you look back 20 years ago, if you have a rectal cancer, they will remove your entire anus and give you a permanent bag on your abdomen. Now all that has changed with advanced technology and newer things. Now we are able to remove the tumor very close to the anus also, preserve your anus so that you can have normal motion passage, but remove the cancer and completely cure it. More recently, in the last 5 to 8 years, we've used new technologies such as robotic surgery to remove this tumor and reconstruct the normal root. Now the advantage of robotic surgery compared to standard laparoscopy, which has been there for 20-30 years, is that now with robotic surgery you have 10 times magnification, 3-dimensional views, less bleeding, less complications. Patients are able to recover quickly, and also the cost. In Apollo Chennai, we worked on the cost, and the cost of robotic surgery and laparoscopic keyhole surgery is the same now. So with this new technology, we're able to do more cancer clearance. We are able to reconstruct the rectum, so that, or the colon rectum area, so that you can have normal root even in spite of removing the rectal cancer, and also have quicker recovery and less complications.
Sir, minimally incisive surgery and the robotic surgery both are same.
So for hundreds of years we've been doing open surgery, where we make a cut and then remove this part. Now that gives more pain, more complications. And so what we moved 20-30 years ago is to keyhole surgery, which is laparoscopic surgery. You use straight instruments to go and remove. Now that is that has been there for 20 years. Now that is one form of minimally invasive surgery. The newer form of minimally invasive surgery is robotic surgery, where we have miniaturized instruments working like your wrist, but they are as big as your nail, and they go deep into the tissues. It causes less tissue damage, so they recover quickly, and so patients also get out of hospital quickly and get back to work quickly.
Sir, what are the benefit and advantage of from the traditional surgery and recent advancement robotic surgery?
So the important differences between open surgery and the newer robotic surgery is that one, there is better vision. You're able to see things, structures clearly, so there is less damage. Two, there's quicker recovery of these tissues, so patients can post surgery can start walking faster, start drinking water and having their diet quicker. They can quickly get released from hospital. They can quickly go and join their work, get back to work faster. And also complications is hernias, bleeding is lesser with robotic surgery.
Sir, you say can be cured colorectal cancer of Apollo Hospital in Chennai can be cured.
So the good thing about colorectal cancers compared to other cancers of the stomach, pancreas, esophagus is that if picked up early, we can completely cure colorectal cancer. So the important thing is to have awareness about these conditions. So if you have symptoms more than 4 to 6 weeks, go see a doctor, get screened. Then if you pick up these cancers early, we can completely cure it with standardized new treatments and advanced surgery like robotic surgery.
Sir, any misconception are there in treatment in our mind that is often counter you?
Yeah, so often what I see is patients are very shy to talk about these problems. They are embarrassed to talk about. We shouldn't be, because now access to knowledge is available readily on your phone, on your computer. You can go and search for these symptoms. You can go see a specialist if you don't know who to go and see, because there's a lot of confusion who to see. So the people can go see the general physician or a general surgeon, but there is more and more we are seeing specialist units to deal with colorectal problems, like the colorectal department in Apollo Hospital Chennai. So where patients with these symptoms, if they don't know where to go, they can always come to these specialist units. There are few in the country. We have one in Chennai, Apollo. So you can come there. We will quickly go through your history, get the right investigations done, and give you a treatment plan so that you have clarity.
What is the recent advancement? I want to say you achieve the any power of treatment, that is robotic surgery, but what is the complications, what is the major challenges of the robotic surgery of the treatment you faced have already?
So when we started the program, the big challenge was the cost, because patients were saying it was double the cost of keyhole laparoscopic surgery. So what we've learned, and we've developed a program where we've reduced the cost to same as laparoscopic surgery. That is the big thing. Otherwise this technology is very safe. It gives a lot of advantages to the patient, but it's expensive. Any new technology is expensive, but as now there are newer robots which are coming into the play, so the cost of robotic surgery is coming down. Other than that, we've standardized the operation to be very, very cost effective, so there is all benefits to the patient.
Sir, anal lumps are the future in convert to colorectal cancer.
So the simple conditions such as piles, fistula are not related to colorectal cancer, but the symptoms are similar. That's where the confusion comes.
Yes.
So you should not ignore your symptoms or presume that they are something simple, because the symptoms are the same. So you should go see your doctor, ideally a specialist colorectal doctor, to go through your symptoms, do the correct clinical examination, doing a rectal examination, and get the correct tests. And once the tests are done and confirmed, the doctor will give you what the problem is, and then you can be reassured.
Sir, when it is needed surgery and when it can be cured medicine?
So again, it depends on what type of condition. As I said, if it's piles or an anal fissure, lifestyle changes and medical treatment should improve it. If it fails, we can always go for surgery. But if it comes to anal abscess or a fistula, always surgery is the treatment, no medical treatment for that. Now, as far as colorectal cancer is concerned, treatment is always surgery. We improve the outcomes of rectal cancer by giving pre-operation chemotherapy and radiotherapy.
Sir, what is the success rate? We want to know in Apollo Hospital Chennai, robotic surgery, recent advancements are there.
So the success rate for colorectal cancer is very good. The standardization of the operation, the specialist service will get you very good results. Now, if you come at an early stage, there is a 95% cure rates with first stage colorectal cancer. With second stage is 80%, third stage is 50%, and third stage 4 is 5%. So it's very important that you come at an early stage.
Sir, is this treatment, is this disease neglected, is fatal?
Yes, if colorectal cancer is neglected, this will spread to other organs and patients will pass away from it. So that's why it's important that not to ignore the symptoms. If you have any rectal bleeding, change in bowel habit, in constipation, diarrhea, passage of mucus, slimy stuff through the anus for more than 6 weeks, you should go see your doctor.
Sir, what is your advice to a recent advancement on treatment to our patient, your patient?
So the important thing is to have a healthy lifestyle. Eat healthy, eat home cooked food, less spicy stuff, less oily stuff, eat out less. Go enjoy yourself, but eat out less, once or twice a week is okay. Exercise regularly, very, very important. Stop smoking, stop alcohol, or cut down, reduce the amount you intake. But important thing is to drink lots of water, exercise regularly, and keep a very fit and healthy lifestyle.
Sir, exercise can be cured colorectal problem?
Yes, once you exercise, your digestion improves and what you eat also gets digested better. So definitely has a big say in curing colorectal problems.
Sir, what type of treatment colorectal problem of pregnant ladies?
So in pregnancy, what we commonly see is constipation, fissures, piles. So there also they need to drink lots of water, a lot of vegetables, avoid red meat, keep yourself fit. Now if you have constipation, you should see a doctor and get a small laxative. If you have a fissure, we can still treat it during medically ointments and things. And if it's a big problem, we can get through the pregnancy, and post pregnancy we can offer surgery if it's not getting better.
Sir, what is recent advancement of your achievement recently you talking about, please?
So what we've done in the last 10 years is they have set up a specialist unit for colorectal patients, where patients don't once they have these symptoms, they come straight into our service. They are quickly, history is taken, investigations done in a very timely fashion, and then if whatever treatment is done in a very organized manner with high success rates. Now with colorectal cancer, we started a robotic program where patients get high tech advanced surgery at a very low cost and with excellent cure rates.
Sir, why patients are choose Apollo Hospital, Chennai?
The reason why people come to us is because we have this specialized, we are one of the first centers to start the specialized service for colorectal service in the country. There's there are very few hospitals in the private hospitals where this specialist service exists. We've had it for more than 10 years now, so patients can be assured that they will get a good timely treatment and best outcomes.
Sir, what is the preparation pre-operation or post-operation to suggest you the new patient you advise?
No, so if they have any symptoms, or as I said, you should take the get on to the healthy lifestyle, eat healthily, exercise regularly, drink lots of water. These are things which you can do at home. If you can't, if symptoms are still persistent and you can't get a specialist doctor to see them, you can contact us on the contact numbers given there, and we will be able to guide you online or on-site advice on what is the next steps to do.
Sir, is this a bad lifestyle disease?
Yes, it is. It is a lot of things to do with lifestyle and what you eat, what you drink, and how much you exercise.
What type of lifestyle changes people can be prevented?
So that's, as I said earlier, drink lots of water, exercise regularly, eat healthy food, cut down on red meat, more vegetables will help you.
Sir, in recent advancement, what is the major achievement of your hospital in recent advancements on the colorectal cancer?
As I said earlier, we have a department where patients come with these problems, get assessed very quickly. We have the colonoscopy, CT, MRI scans, PET CT. Once these assessments are done, then we can tell you what stage the disease is, send you for pre-operative chemoradiotherapy or surgery. And in surgery, we do advanced robotic surgery to get the best outcomes with excellent results.
Sir, do you have any chamber in Kolkata for Kolkata's patient, West Bengal patient? Because every time we do not go to Chennai for treatment, not possible to everyone. So therefore.
So we have the Apollo Hospital Chennai regional office in Calcutta. The contact numbers are given at the bottom. Please contact them. Our specialists will come here cyclically every few months. So, and also they're available online as well. So we will be able to connect with them and advise them and consult them for anything very specific surgery or advanced treatments or advanced tests. You may have to come to Chennai, but most of the other consultation can happen here.
Sir, thank you for coming from Chennai and about all these clear ideas.
Thank you.
Sir, firstly, I want to know that question repeatedly, why people are recently most affected from this type of disease? Only for bad lifestyle or other things are there?
So important thing is, one, these things will with age you will develop these symptoms. So that is one issue. Then there could be a family history of colorectal cancer, so that risk can run in families. So if you have a family history of colorectal cancer, you need to go get screened. 3, lifestyle, you're not exercising enough, eating a lot of junk food, not drinking enough water, not taking enough vegetables. These can all cause these symptoms and diseases.
Sir, what is the patient conditions in individual? Treatment is depend on the patients or the conditions?
Both. It depends on patient being aware, and when they have their condition, they need to reach out to the specialist for correct diagnosis and treatment. So once that is done, then the treatment becomes easier.
Which situation is not be cured?
It depends on which condition you come with. Most of these things can be cured if you come at an early stage. The benign conditions, fissure, fistula, perianal abscess, piles, all this can be cured. Colorectal cancer come at an early stage, we can completely cure it. Coming at an advanced where it's all spread, then it becomes difficult.
Sir, only adults are facing the problem or children also have?
Constipation is very common in all age group, particularly young babies. As they grow, the diet changes, so constipation is there. They just have to eat healthy diet, lot of water, avoid biscuits, a very balanced diet. A lot of vegetables is important even in children. But colorectal problems are common and affects all age groups. But cancers are more common in older, but it's becoming commoner in younger age group now.
Sir, repeatedly we want to know what is the major changes, traditional treatment and the recent advancement treatment of our hospitals of Chennai, Apollo hospitals of Chennai.
So the recent improvements is that, one, we have a specialist service. 2, the services streamlined so that patients can get timely treatment. There's a lot of advanced robotics happening, so there's a one-stop center for all your colorectal issues.
Okay, sir, thank you for coming.
Thank you.
Our time is only 22 minutes and you have such a wonderful idea to get it. So thank you for coming from Chennai and explain the major things of colorectal cancer and all those diseases. So thank you. আপনারাও সকলে খুব ভালো থাকুন এবং স্যার যে সমস্ত বিষয়গুলি আজকে তুলে ধরলেন, কোলোরেক্টাল ক্যান্সার মানেই যে শুধু একেবারে ভয় পাওয়া, একদম জীবন শেষ হয়ে যাওয়া, এমনটা না। স্যারদের মতো এক্সপার্টসরা রয়েছেন, এক্সপার্টস ডক্টররা রয়েছেন, তারা বিভিন্নভাবে কিন্তু যে সমস্ত রিসেন্ট অ্যাডভান্সমেন্ট রয়েছে সব কিছু দিয়ে অ্যাপোলো হসপিটালস চেন্নাই আপনাদের জন্য কিন্তু অপেক্ষা করছেন। যারা মুমূর্ষু রোগী, যারা একেবারে হতাশ হয়ে গেছেন, সমস্ত আশা শেষ করে দিয়েছেন, না, আশা শেষ হয়ে যাওয়ার নয়, কারণ অ্যাপোলো হসপিটালস চেন্নাই রয়েছে আমাদের সকলের পাশে রয়েছেন এরকম এক্সপার্টসরা। তাহলে আজ এ পর্যন্তই। সমস্ত ভয় কাটিয়ে আপনারা এগোতে থাকুন, ভালো থাকুন, দেখতে থাকুন আর প্লাস নিউজ, সবার আগে সবার কাছে।